House Bill 799, Delegate Morgan, State and Local Government COVID-19 Vaccination by Choice Act. Good afternoon, Delegate.
Good afternoon, Madam Chair. Thank you for letting me present this bill to the committee. It's COVID-19 Vaccination by Choice Act. And what this bill is a tightly tailored bill that would prevent state and local government, including the university system and the K through 12, from requiring a COVID vaccine as a condition of employment. The theory of this bill is, well, hopefully state and local governments could lead the way, enabling choice. And hopefully businesses would pick up and follow our lead. Now, I will tell you that it's interesting how this bill came about, because I was doing a debate earlier this year, last year, December timeframe, with one of my colleagues here and one of our good friends across in Senate Finance. And I was speaking to a graduate class, and I was shocked to learn that, most people didn't know that the COVID vaccine, they think it stops transmission. And I've heard a couple of questions as I'm watching the bill hearings where it's like, well, we need to mandate this vaccine because it's for the public good. So I'd like to share a quick video with you to maybe dispel some of those rumors, if I could.
Let me, Susanna, will you be so kind and allow Delegate Morgan to share, please?
Yes, he should be able to now.
Okay, thank you.
You're okay. You're not going to get COVID if you have these vaccinations.
These vaccines are highly, highly effective.
Vaccinated people do not carry the virus, don't get sick.
They're really, really good against variants.
Everyone who takes the vaccine is not just protecting themselves, but reducing their transmission to other people and allowing society to get back to normal.
Get your first shot, and when you're due for your second, get your second shot.
Our key goal is to stop the transmission, to get the immunity levels up so that you get almost no infection going on whatsoever.
When people are vaccinated, they can feel safe that they are not going to get infected.
If you're vaccinated, you're not going to be hospitalized. You're not going to be in an ICU unit, and you're not going to die. If you are fully vaccinated, you no longer need to wear a mask.
Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing.
But what they can't do anymore is prevent transmission.
We didn't have vaccines that block transmission. We got vaccines that help you with your health, but they only slightly reduce the transmissions. We need a new way of doing the vaccine.
The level of virus in the nasopharynx of a person who's vaccinated and infected is the same level as the level of virus in the nasopharynx of an unvaccinated person.
Reports from our international colleagues, including Israel, suggest increased risk of severe disease amongst those vaccinated early.
And if you look at Israel, which has always been a month to a month and a half ahead of us, they are seeing a waning of immunity, not only against infection, but against hospitalizations and to some extent death.
I think we need to be careful as we get vaccinated not to overinterpret the results. Our results show that this vaccine can prevent you from being sick. It can prevent you from being severely sick. They do not show that they prevent you from potentially carrying this virus transiently and infecting others.
Who've been double vaccinated. We know it's around 60% of the people being admitted to hospital with COVID have been double vaccinated.
I hear a lot of times people feel it's a rare event that fully vaccinated people may die. I happen to be the senior advisor to Governor Hogan in the state of Maryland. In the last 6 to 8 weeks, more than 40% of the people that died in Maryland were fully vaccinated.
So vaccines obviously don't prevent transmission. And it was really good to see Dr. Fauci. I miss him on the Sunday shows. Ever since that last bit of polling came out, he seems to be on lockdown or something. But yeah, on transmission, if you want to take a look, and anyone that thinks this, I say you probably should check out our own website at Maryland COVID I believe it's .org. You go to the bottom there, it tells you that there's been 448,000 cases of breakthrough cases in the state of Maryland. We know that number is extremely low because as people, got COVID again or tested with a home test kit, those numbers weren't recorded. I would also caution that the other part of hinging on a vaccine mandate is not having any adverse effects from the vaccine. If you look in Google search VAERS database, there's been about 1.2 million people that had adverse effects from it, or they think they had adverse effects from the vaccine. And I've never seen where government has mandated something that people also, that doesn't have any public health and they might have an adverse effect from. I'd like to turn it over to my sponsor panel, Dr. Ron Elfenbein, for more information, Madam Chair.
Thank you, Delegate, for your testimony. We really appreciate it. Dr. Elfenbein, you have 2 minutes, and good afternoon. Thank you for being with us today.
Good afternoon. Thank you for having me. Thank you, Delegate
pleasure.
Morgan. So I am, just a little bit of background, I'm a board certified Johns Hopkins trained emergency medicine doctor. I practice at multiple facilities throughout Maryland and Delaware. I'm the president of the Somerset County Medical Society. I'm a regular on national and international TV speaking about medical issues. And I'm the medical director and owner of First Call Medical Center. We're the busiest monoclonal antibody infusion center in the state of Maryland treating COVID patients and the largest private testing facility as well, having tested well over 1 million people throughout the pandemic. So I'm testifying in favor of House Bill 799. Let me start off by saying that I am 100% pro-vaccination, having gotten vaccinated as early as I possibly could. My wife, also a physician, got vaccinated, and we vaccinated all of our children who are eligible to be vaccinated. But if the goal is to minimize the spread of COVID-19, there's absolutely no justification to mandate vaccination. The risk of spreading COVID-19 is the same whether you've been vaccinated or unvaccinated, especially in light of the recent data from the Omicron surge. So the benefit to getting vaccinated is to the individual, not to society. And it's to the individual in terms of survivability and likelihood of needing hospitalization. The vaccine was never designed to prevent infection. The FDA and the CDC were perfectly clear about this from the very beginning. It was designed to prevent hospitalization and or death, which it does very well, and it still does well today, less so than it did, but does still pretty well. The vaccine is not without risks. There's Guillain-Barré, there's myocarditis, there's anaphylaxis, there's blood clots. So it's not like drinking a glass of water. It's not without consequence. There's real risks to being vaccinated. And remember that there's natural immunity. If I want to get hospital privileges at any hospital, I have to demonstrate that I have natural immunity to hepatitis B, measles and mumps and rubella. If I have to get a blood test. Why can't we do that with COVID? Why are we treating this virus differently? Why has it become so politicized? Why would we fire people who've been working throughout the entire pandemic without a vaccine now that we have one available? Why do we marginalize people, especially if those people don't pose an increased risk to anyone else, given that the risk is the same whether you've been vaccinated or not? Thank you very much for my time.
Thank you so much for sharing your experience with us. We have next Ms. Jenna Butler. Is she here, Susanna?
Yes, she just has
I
to.
did the same thing again.
Oh, it's okay.
I'm sorry.
It's all right. It happens. Go ahead.
Hello again. My name is Jenna Butler. I'm here in support of HB799. Today, I'd like to share with you statements from Maryland employees and who have been affected by vaccine mandates. And I ask you to listen and consider these carefully. As has been mentioned several times during this hearing, this committee has always been very considerate of these issues, and I would like to share these with you. From Kimberly Eisman, I am a 13-year ER nurse. I had COVID in 2020 and I didn't want the vaccine. I was harassed in my hospital and fired. From Jacqueline Zoko-Kuna, my husband has been on unpaid leave since November. We have all but exhausted our savings living on one income in Montgomery County. He was hospitalized in early January for what doctors termed stress-induced PTSD. In the past 2 months, we have seen him for a total of 36 hours as he went out of state to train for a new career. From Erica Sprague, I was a speech-language pathologist working with kids with autism. When I was fired, I was working completely online and I had already had COVID. Not only did this policy not make sense, but it hurt the children I was working with. From Teresa Marlowe, I was gainfully employed by the City of New Carrollton Police Department with 10 years of exemplary employee evaluations, including one dated from the day before I was terminated for failure to comply with the vaccine mandate from an anonymous state employee. My husband was forced to get the vaccine to keep his job and his retirement benefits. 4 weeks after being vaccinated, he developed a severe case of COVID-19. Currently, his agency has a policy that you must show proof of vaccine to even apply for a job. From Mandy Ryan, I'm the sole provider for my family and couldn't afford to lose my job. I'm a cancer survivor and take a prevention medication that could potentially cause blood clots. I was denied a medical exemption. Now I'm being mandated to get the booster or be terminated. From Lisa Mark, I'm an RN who was forced to get the COVID vaccine to keep my job. I submitted a VAERS report for nervous system adverse events after I had the first dose. Thank you.
Thank you for sharing their experiences and let them know that we heard you. Next, we have Ms. Sarah Cusack.
Thank you again, Sarah Cusack, in support of this bill. I am sympathetic to everyone who was trying to stop the virus and stop the pandemic. But on this mandate, people were mandated to take a warp speed product that was created under the Trump administration. 2 of them were novel technology, mRNA. We've never had an mRNA vaccine before. They had 3 choices of products. They could take Moderna, who's never had a product on the market. The FDA has never approved one of their products. They could choose Pfizer, who has the distinction of paying the highest criminal fine in the history of our country for fraud. Or they could choose Johnson & Johnson, who had to pull baby powder off of the shelves in 2020 because they knowingly allowed an asbestos cancer-causing ingredient to be in there. None of these companies were liable for any injuries or deaths that their products were going to cause. They were protected by federal law. Unlike childhood vaccinations, no federal compensation program was set up to protect the people who were mandated to take these. The Trump and the Biden administrations, neither of them funded a compensation program. These were their choices, and I'm here to testify to you today to let you know there is a deep resentment in our state from people who were forced. Many of them were forced and went on to get the virus. Just this week, CDC Director Rochelle Walensky says, oopsie, we didn't really think to ask if it was going to wane or if these would really protect against future variants. And yesterday I see the headline that Pfizer is saying, we're definitely going to need a 4th dose to ever get back to normal. We have to have some protection against mandates. Let people work with their doctors and do what is best for them. Thank you.
Thank you for your testimony again, and we appreciate it. Next, we have Ms. Megan Montgomery.
Good afternoon. This will be my last time today appearing before you, so thank you for your patience. My name is Megan Montgomery. In addition to being the chair of the Love Maryland PAC, I'm a member of a biracial family in a Title I school district. This bill is desperately needed because the people in my community are the people that rely the most on government services, and we do not all have the ability to hop in our cars and drive to a private hospital if we do not have essential personnel being able to serve us in our community. Look at what happened in Montgomery County when they were looking at their own vaccine mandate. At one point, almost 30% of their county employees, including essential personnel, were threatened with being fired. We cannot afford to lose 30% of our policemen, of our firefighters, of our nurses and our doctors and our EMTs. This will hit the most vulnerable residents of our communities. And vaccine mandates are not based on science, as we've heard repeatedly. In my written testimony, you will see page 48 of the Pfizer FDA submission and the Johnson & Johnson fact sheet, where those companies specifically state that the vaccine is not known to reduce transmission or contagion. Finally, this bill would prevent non-elected government officials from playing politics with our citizens' basic needs. For this and the reasons written in my written testimony, we ask you to support this bill. Thank you.
Thank you for being with us today and sharing your thoughts and feedback. We appreciate it. Next, we have Mr. Mecca Mohammed. Susanna, did the person make it?
No.
Okay, so I'm opening it up now for questions on this favorable panel. First, we have Delegate Chisholm.
Thank you, Madam Chair.
My pleasure.
Thank you, Delegate Morgan, for bringing this bill. My question is for Dr. Ron Elfenbein. He had mentioned monoclonal antibodies. I was curious, and from what I had learned, they were very effective with all COVID or most COVID patients. How many of the monoclonal antibody patients that you treated were fully vaccinated in comparison to non-vaccinated, if you have an idea?
Yeah, it's an excellent question. Thank you for it. I think off the top of my head, this is somewhat of conjecture, but it's probably about 60-40, 60 being unvaccinated, 40 being vaccinated. And just to clarify that it is an incredible treatment for all COVID patients. This is about almost a 90% efficacy at keeping people alive and or out of the hospital after they've tested positive for COVID. So it's a game changer, an incredible treatment.
Yeah, it's a lifesaver. So thank you, Dr. Ron.
Yeah.
Thank you, Madam Chair.
My pleasure. Thank you for your question. Next, we have Delegate Krebs.
Thank you. I'm going to ask Ron the same question I asked the last panel on the last bill. Do you know, I mean, you do all this testing and do the monoclonal antibodies. When the people are released, do you know of any type of studies or any kind of direction that people are given with regard to how to go get antibody testing and what the protocol would be going forward to make sure you're still immune?
Well, I mean, we offer blood antibody testing, and there's multiple labs that will do it. It's very simple. As I said before, if I want to get hospital privileges at any hospital, I have to get my antibodies tested for various other illnesses and various other diseases. So it's readily available. You can go to Quest, you can go to LabCorp, you can come to us, you can come to pretty much any laboratory that can send out blood to have it done. It's widely available and very easily accessible. In regards to the actual number of antibodies, it really depends on which antibodies you're talking about. It's not just a simple thing of whether you have antibodies or don't. There's IgA, there's IgG, there's IgM, there's all kinds of different antibodies. And then even to that, there's different antibodies to each protein. So you really have to be more specific to say which antibodies you're speaking of. But it's very easy to measure levels to say that you will have immunity based on this particular antibody to the spike protein, for example, or to the nucleocapsid protein. You could very easily measure that, and we've already determined what levels is safe to make you quote unquote immune to it. So it's very easy to do that, and it's very readily accessible. I don't know those numbers off the top of my head, but
I mean, we're the HGO committee, Health and Government Operations, and we do public health. And we really, in the last 2 years myself, I've just not heard a lot about what the protocols are and the testing or even any studies on it. That's just something of interest, and I think we should follow up with as we move forward. But thank you.
Yeah, and this is very confusing, and it's very new to people. And remember, too, that the human immune system is not so simple as whether you have antibodies or don't have antibodies. There's a lot more to it. There's T cells, there's B cells, there's memory cells, there's killer T cells. So there's a lot to it that comes with natural immunity that doesn't necessarily come with vaccine-induced immunity. And remember, too, this is an important point, that when you get a vaccine, whether it be the mRNA or any other vaccine, specifically the mRNA vaccine, you're getting antibodies to one protein and one protein only. That's it. When you get infected with COVID, you are getting antibodies to every single protein on that virus. So natural immunity will always trump vaccine-induced immunity for any virus, because you have so many more antibodies produced rather than just the one that you get with the mRNA vaccine.
Any other question, Delegate Krebs? Okay. Are there any? Yes, Delegate Hill.
Thank you. Dr. Eifenbein, thank you very much for what you've been doing through the pandemic. You talked about the fact that if a person is vaccinated, it doesn't stop them from transmitting. But from a population health, where we're concerned about things like resources, making sure that hospital beds aren't taken up by people who could have perhaps not been exposed or not come down with the vaccine, et cetera, et cetera. There is an issue there with getting, in other words, is there not more to an individual getting vaccinated than protecting themselves? Is there not a community component to it also? Because most of our vaccines don't prevent you from transmitting hepatitis, doesn't prevent you from transmitting TB. That what it prevents you from doing theoretically is getting the disease, and that takes one more person out of the population who could expose someone else, right? So isn't it sort of simplistic to say that since the vaccine doesn't prevent transmission, there's no population health community benefit to numbers of people getting vaccinated?
Well, I never said that. What I said was that the vaccine doesn't prevent somebody from catching the virus and spreading the virus.
Right,
So,
no vaccine does.
Well, I think certain vaccines will prevent measles, for example, prevents you from catching measles and spreading it to somebody else. So it does. There are vaccines that prevent you from catching and spreading the virus. Measles is an excellent example of that. Or you can look at smallpox. The smallpox vaccine absolutely stopped people from catching and spreading smallpox.
But they spread it because they caught it. So it stops them from catching it. That's how it stops them from spreading it. So similarly, the COVID vaccine, by stopping you from getting it, it can stop you from spreading it.
But the data doesn't support that in any way, shape, or form. The data is very clear about that it doesn't stop spread. So whether, if I'm vaccinated, fully vaccinated and boosted, I am hopefully not going to die from COVID. Right. But in fact, I think I caught it 3 or 4 weeks ago.
Right. If you're colonized with it,
Delegate Hill, let him finish. Delegate Hill. Delegate Hill.
That is correct.
Delegate Hill, 1 second, 1 minute.
I'm sorry, Madam Chair, there are population health benefits to have.
Delegate Hill, 1 second, please. 1 minute. 1 second, sir. 1 second. We have rules here. Okay, so we have to have respect and let him finish his testimony, and then you can ask the question, okay? So I'm sorry, sir. Will you continue with with what you're saying, okay?
Thank you, Madam Chair. I think you're conflating two things. First of all, I never said there isn't a population benefit to getting vaccinated. So yes, it does keep people from being hospitalized, which I clearly admitted, and I believe so. And again, I'm very much pro-vaccination. So from that perspective, it's a great thing. It keeps people from dying and or needing hospitalization. If you look at the data, which again is very, very clear about this, initially, when this first came out and the vaccines were first introduced, they were very good at two different things. They were very good at keeping people from needing hospitalization and or dying, and they were very good at keeping people from catching COVID. Over time, the latter has waned significantly, and it's not so good at keeping you from catching COVID anymore. It's still pretty good at keeping you from dying. It's not great at it, but still pretty damn good at it. So if you catch COVID, having been vaccinated and boosted, your chances of dying and or needing hospitalization is still much lower than if you hadn't been vaccinated. So I would encourage everybody to get vaccinated. But that's not the same thing as saying that everybody has to get vaccinated because there's some societal good that will keep me from spreading it to somebody else. Whether I've been vaccinated or not doesn't reduce your chance of catching COVID from me. That's what I was saying. And I think that the data is very, very clear about that.
So let me first apologize for stepping on your answer, and I hope you'll accept my apology. Second of all, I would agree with you, and in fact, except that when we had our very first hearing with the Department of Health, and the question I asked was why, if it's so good at stopping prevention, why aren't we just vaccinating the caregivers and not the people in the nursing home when we have limited amount? And the answer was, we don't know if it will stop people from spreading COVID, right? And so the answer we got, at least, was there was no clear data, and that was consistent throughout. And because this bill says there's no benefit, and I thought your testimony, thank you for clarifying, I thought your testimony was that it's simply an individual choice. And of course, you have to weigh the risk of unknown short and long-term ramifications to vaccinations, but there is a community benefit, and I appreciate your acknowledging that again. Thank you. Madam Chair, I apologize.
Okay. Thank you for apologizing. I appreciate it. We have to always just have respect for each other regardless of our differences. Mr. Elfabens, is there anything else that you would like to add?
I think that we all have to come to the realization that we're not going to vaccinate our way out of this. We have 3 vaccines available to us in the United States that are very, very good. We have multiple oral and intravenous treatment options, which are also incredibly good. As I said before, we're never going to vaccinate our way out of this. It's going to become an endemic problem, which it already has, and it's not going to go away. It's not something we can beat like smallpox, which has been eradicated in the wild. It's not going to happen with COVID. So I think we all have to just move on with our lives and realize that we need to protect those people who need to be protected, which we can do now. We can treat those people who need to be treated, which we can do now. And we just need to move on. And I think that the quicker we can do that, the better for everybody.
Thank you.
So thank you very much.
Our pleasure. Thank you for being with us. Any other questions for this panel? Okay. Seeing none, actually, this will conclude the testimony on House Bill 799. We really appreciate you being with us today.
Thank you,
and
Madam
sharing
Chair.
your experiences. Our pleasure. Next, we have House